Hello, everyone from Arkansas State University, the College of Nursing and Health Professions. I am family nurse practitioner student Ashley Early. Today, I'm going to talk with you about an examination of statin therapy prescription rates among diabetic patients between the age of 40 and 75 with known existing cardiovascular risk. I'm going to be giving a brief overview of the introduction and purpose, objectives, methods, population, findings, discussion and action plan, acknowledgments, and references of the research that I have been able to participate in while attending Arkansas State University. It is estimated that there are more than 200 million people worldwide diagnosed with diabetes. Atherosclerotic cardiovascular disease is the leading cause of morbidity and mortality for individuals with diabetes and results in an estimated $37.3 billion in cardiovascular-related spending each year. The purpose of this study is to compare the rate of diabetics prescribed statin therapy at a rural Arkansas clinic to the national average of approximately 32%. Diabetes affects the microvascular and macrovascular structures of the body. Patients diagnosed with diabetes can be up to 4 times more likely to develop CVD or stroke. It is for this reason that the American Diabetic Association, in conjunction with the American College of Cardiology and the American Heart Association, have recommended clinical guidelines to treat these patients appropriately. The results will help providers at the rural clinic gain insight into their performance as it compares to the national average. The rural clinic will then have a baseline performance level to use for future quality improvement goals. This study was conducted at a rural clinic in Arkansas, and a retrospective chart review was conducted of 50 charts using the clinic's EMR. IRB approval was obtained through ASU, and a data collection tool along with simple mathematical calculations were utilized to determine the percentage of patients receiving statin therapy. Inclusion criteria for this study included both male and female patients between the ages of 40 and 75 years of age with a diagnosis of diabetes using the ICD-10 code E11.9. The findings of this study found that the rate of treatment of statin therapy among the qualifying diabetic patients at the rural Arkansas clinic was 86%. In comparison, the national rate of statin prescription to qualifying diabetics was approximately 32%. The 86% rate of statin prescription to qualifying diabetics at this rural Arkansas clinic was significantly better. Hyperlipidemia is a disorder that affects more than 71 million people in America. These patients are at an increased risk for heart disease, which is the leading cause of death in the United States. This is a diagnosis that can be managed in the primary care setting, and diabetics are 2 to 4 times more likely to die from heart disease. This is why the recommendations put forth by the American Diabetic Association, the American College of Cardiology, and the American Heart Association should be considered. It is evident in the research that the initiation of statin therapy to those at risk for the development of CVD can regress hyperlipidemia and help to prevent a life-threatening cardiovascular event. The study of coronary atheroma by intravascular ultrasound, effect of rovastatin versus atorvastatin, or SATURN, was explicitly designed to look at patients with existing atherosclerosis. Aggressive LDL cholesterol lowering with high-intensity statin therapy can regress coronary atheroma and reduce the incidence of cardiovascular events in patients with established CAD. Primary care providers should consider the recommendations regarding statin therapy and consider prescribing to the appropriate patients to help prevent major cardiovascular events. I would like to thank Arkansas State University's Dr. Chris Jordan and Dr. Mark Foster from the College of Nursing and Health Professions for mentoring me and guiding me through this research project. I am so grateful and thankful for the time that both of you have spent with me. Thank you to Create AState for letting us present our projects in this format this year. And thank you to Arkansas State University for always supporting us throughout our education. And a big congratulations and best wishes to the graduating class of 2020.